Hi guys, today I will discuss different syndromes. Two important syndromes are Marfan syndrome and homocystinuria. And these two syndromes, they are similar in many ways, but there are some differences as well. As far as Marfan syndrome is concerned, it is autosomal dominant while homocystinuria is autosomal recessive. The abnormal chromosome is 15, which encodes a protein which is called fibrillin. And on the other hand, in a homocystinuria, the abnormality is on chromosome 21. If we discuss Marfan syndrome first of all, we'll discuss its skeletal abnormalities. As you can see in the picture, that arm span is more as compared to height, or it is equal to height. And after that, there is arachnodactyly, which means that hypermobile joints and hypermobile fingers. Then after that, patient can have kyphoscoliosis. And as far as the cardiovascular complications they are concerned, patient has got aortic root dilatation. There are more chances of aortic dissection, aortic aneurysm, and then after that comes mitral valve prolapse. Then there can be dural ectasias, and after that, in Marfan syndrome, patient can have upward dislocation of lungs, while in homocystinuria there is downward dislocation of lungs. Plus, in homocystinuria, patient also has recurrent history of venous thromboembolism, and there can be libido reticularis as well in homocystinuria. In homocystinuria, there is a deficiency of an enzyme which is called cystathione beta synthetase, and usually homocysteine level in blood they are raised, and cyanide nitroglyceride test is positive, and treatment is by vitamin B6. While on the other hand, in case of Marfan syndrome, we just see that heart is doing fine or not by doing annual echocardiography and by giving beta blockers and ACE inhibitors. So homocystinuria, it is very similar to Marfan syndrome in skeletal abnormalities. Like it has also called arachnodactyly, then there is also kyphoscoliosis, and arm span can also be more as compared to height. Then another favorite exam question is osteogenesis imperfecta, which is actually defect in type 1 collagen, and this is a very interesting mnemonic, which is BITE, because there is defect in collagen 1, so bones they are fragile, and there are multiple fracture of bones, and there are blue sclera, there are dental imperfections and hearing loss. Another collagen defect is ehler syndrome, in which there is defect in collagen 3, but in some varieties of ehler syndrome, there can be defect in collagen 5 too. And E for elasticity, remember this thing, that there is increased elasticity of the skin and increased mobility of joint. So when skin is more elastic and mobile, there is easy bruisability, and plus joints, they are more mobile in Ehlers-Danlos syndrome. So you can see here that in Marfan syndrome, in homocystinuria, homocystinuria joints are rigid, but in Marfan syndrome and in Ehlers-Danlos syndrome, joints they are hypermobile. And other features they are less common. They do not usually come in exam. And this is the common face of an Ehlers-Danlos syndrome patient. You can see that nose is uh, usually narrow, and upper lip is also narrow, and low set ears and bulging eyes. So this is a typical face of Ehlers-Danlos syndrome, with a beautiful nose and bulging eyes. Then another syndrome which is called pseudoxanthoma elasticum. So remember by elasticum that it is basically a congenital defect in elastic tissue. So elastic tissue, they are present everywhere, in blood vessels, in eye, in skin. So patients usually have plucked chicken appearance, as you can see that skin folds they are hanging, and just like plucked skin. Then there can be angioid streak in the eye, and when elastic fibers of blood vessels they are defective, it can lead to bleeding and different arterial problems. This is angioid streak which is present in pseudoxanthoma elasticum.